welcome you to this webinar on Carbetocin in action. At Hetero, we market products in different therapy areas like in gynecology, orthopedics, derma, etc. We have very strong R&D support and we have developed many unique formulations keeping patient benefit in mind. Recently, we have introduced Carbetocin. Carbetocin, as we know, is used for prophylaxis or prophylactic management of PPH. PPH is a condition which is good to read, but which can potentially lead to disaster. While there are several papers and guidelines which suggest use of Carbetocin, we would like to have experience from our own doctors on use of Carbetocin. Today, we have eminent speakers, Dr. Rajendra Nagarkatti, to give his experience on Carbetocin. Welcome, sir. Dr. Rajendra Nagarkatti, sir, is MD, FCPS, DGO, and DFP, MBBS and MD from St. GS Medical College and prestigious KM Hospital, gold medalist at DFP examination and second rank holder at DGO examination. Sir has done 2 years of lecturership at with Gynec and Obstetrics in Sion Hospital, consultant obstetrician and gynecologist, Ashirwad Maternity and General Hospital, Mira Bhayandar, consultant obstetrician and gynecologist at Wokhard Hospital, Mira Road, IVF consultant, Profort IVF Center, Kandivali, member of MOGS, IMA, AMC, Bhayandar Medical Association, vice president of Association of Fellow Gynecologists, trustee in a few trusts, and member of board of few educational institutions. Sir is a born social worker, regularly organizing rural medical and surgical camps around Mumbai. Welcome, sir. Welcome, Dr. Nagarkatti, for your experiences on Carbetocin.
Thank you, Dr. Prashant, for the kind introduction. And yes, so we are here to discuss my experience, our experience in general with the use of Carbetocin. So, yes, so first and foremost, the use of Carbetocin in normal delivery. So this is about a patient, Mrs. X. She's gravida 3 para 1 with a previous cesarean and now in labor. And during intra-op, she was having atonic PPH. All the traditional methods were used like oxytocin, methyl argometrin, misoprostol, prostadine, but the bleeding continued. And later, 1 dose of injection Carbetocin was given, which controlled the PPH. So I think in this case, like as it is saying, they used all other methods. They tried all other methods and it failed, and then they used Carbetocin. I think Carbetocin should be the first line of treatment, and it would have brought about immediate control of the PPH. It is far superior in action to all of these other uterotonics, and generally, when given, it does not require the need of any other uterotonic. Yes. Yeah, this is case study 2. This is use of Carbetocin in high-risk pregnancy. This is Mrs. X, gravida 3 para 2, living 2 children with previous normal deliveries and now has severe anemia and has come in labor. Carbetocin was given immediately after the delivery of the baby and the placenta, which reduced the blood loss and prevented PPH. So here again, with she becomes a multipara. Multipara patients are prone to PPH, and so therefore, rightly so, Carbetocin was given immediately after the delivery of the baby, and it immediately brought about good contraction of the uterus and reduced the blood loss and prevented PPH. This is a third case study. Mrs. X, primary gravida with twin pregnancy, 34 weeks, and severe preeclampsia, was taken for emergency LSCS as a prophylactic measure. Carbetocin was given immediately after the delivery of the twins and the placenta, and that prevented PPH. This is again another case where PPH is expected and where it was given, and it helped in preventing PPH in such cases. So I think we should identify cases which are. Yes, sir. You wanted to say something?
No, sir. Here in this case too, we use Carbetocin immediately after the delivery, essentially because the patient is a multi-gravida.
Yes, definitely.
There
Because
the risk is
the
more in
ideal
those
time to
cases.
give the this is with the after the birth of the anterior
Correct,
shoulder,
correct,
but
correct,
you can give it also immediately after delivery of the baby.
correct,
Here again, it is saying baby and placenta, but you can give it immediately after delivery of the baby because it will
correct.
help in a proper
Expulsion
expulsion
of
of the
products,
placenta
expulsion of
also.
placenta. Yes.
Yeah.
Sorry, you're saying something here.
Yeah, so this is again another high risk case which is prone for PPH. And so here again, it was given immediately after delivery of the twins and placenta. Again, here also, it's rightly said in twins, since there is a second fetus is still there inside, we have to wait for the delivery of both the
Correct.
twins and the placenta, and then the carbetocin was given. But this is one condition where they are very, very prone for PPH, and therefore rightly so carbetocin was given and it helped in preventing PPH.
One of the reasons could be uterine atony because of the stretching of
Yes,
uterus, maybe.
because of the
Yes.
overstretching of the
So,
uterus.
uterus. Right. It's a wonderful insights. So we have seen use of carbetocin in all three types of deliveries: a normal delivery, high risk, a cesarean section.
Yes.
So just a few questions which have come to us from the field. What is your own experience of using carbetocin? In short, I will say, have you seen a failure with carbetocin?
Sorry.
Have you seen a failure with carbetocin? The drug
Uh,
has not worked.
Not really. Sometimes it may not give the very desired. I would say maybe in 1 out of 10 or 2 out of 10 patients, it may not give the desired hard contraction.
Hmm.
Sometimes, yes, we need to give an additional uterotonic agent, but
And
by
which
and
one would
large,
you?
there is generally no need of giving any additional uterotonic.
But suppose if you have to use an additional uterotonic, which one would you prefer?
We generally prefer carboprost.
Carboprost.
Yes.
There is no what I say recommendation on on carboprost. No, adverse or favorable.
No. There is
There is
no
no
adverse
restriction on,
effect of using combination of carbetocin and carboprost.
and there is no restriction on use of carboprost also.
No.
So your experience of using carbetocin is generally good, and you prefer which route, IV?
Yes, IV.
Right. Which patient profile? I mean, you have shown all three patient profile where doctors can anticipate PPH.
Yeah,
But
correct. So
any other
whenever
profile?
we anticipate PPH like previous cesarean, what we just discussed, anemia, twins, or polyhydramnios,
Okay.
PIH, etc. Here, these are the cases where
Even even fibroid, I suppose, can
correct, correct. Yes,
fibroid. Can also, yeah.
yeah.
And sir, post delivery, post day, I mean, the patient is past your delivery date. Would the patient be prone for more PPH?
If she's past a delivery date, not just by because of being post dated, but if she has prolonged labor, then yes.
Why I was asking is that post date essentially would mean the fetus is growing. It will grow in the uterus, and that would mean extra stretch to the uterus.
Yeah. That is true. If she, yeah. So basically, it means big baby. Any kind
Big
of
baby, yeah,
big
yeah.
baby, large for gestational age,
Uh-huh.
even if it is at term or post term,
Okay.
they can be prone for it. As I said, polyhydramnios, they can be prone for it.
Yes, yes,
Prolonged
yes.
labor, uterine inertia, these are also patients where they are prone to it.
Absolutely. When would you prefer
Carbetocin.
over oxytocin for prevention of PPH? I mean, oxytocin is one brand upon Sagani we have read in textbooks. And when would you prefer actually carbetocin?
I think in all the cases we can give carbetocin over
Mm.
oxytocin because
Oxytocin,
oxytocin is there mainly for augmentation of labor and for the
dilatation.
dilatation and all that. But once she has delivered, then carbetocin would be better because it has a better, longer half life, and therefore the action remains for a long period of time, so that the uterus nicely contracts and
Okay,
retracts,
okay.
and there is less chances of PPH developing later on.
I
Secondary
saw,
PPH, etc., chances become less.
I suppose carbetocin doesn't require that much of a cold chain, which oxytocin requires.
Correct. Because it is heat stable, so it
Yes.
doesn't require that cold chain, that oxytocin. Yes, perfectly right.
Yes, that's a hassle in many places. Even in our place,
Yeah,
Mumbai, many of the times there is power outage and all these
correct,
problems happen.
correct,
Yes.
correct. And
Uh,
especially so in rural areas where they may not have the
Absolutely,
fridge.
absolutely,
Yeah,
absolutely.
yeah.
And plus in rural areas, that IV facilities which is required for oxytocin again may not be possible, I mean, at all the places.
Yeah, yeah,
Where
yeah.
when,
Correct.
when we were doing our internship in the interiors, I mean, it would not be possible to have IV placenta.
Correct.
Yes.
Correct. Correct. Correct.
Can we use carbetocin in case of retained placenta?
Yes, definitely, because it will help in the contraction, and of course the
Expansion.
idea would be to give the injection and also simultaneously go for a manual removal, so that once you have removed the placenta, by then the carbetocin has full action, and the patient will not have pph, because sometimes after you do a manual removal of placenta, patient may get pph.
Correct.
So for that this will help.
Yeah. We will contract the uterus after that.
Yes, yes.
This is a question which has been coming pan-India. Can we use carbetocin in Rh negative mothers?
Yes, I think so. There's no contraindication for use in Rh negative patients,
But
because we are giving it after delivery of the baby
after,
and the
yes.
placenta. So there's no contraindication.
And
Probably
secondly,
here, this is one condition where it would be better to wait till the
exactly.
delivery of the placenta.
Yes. And again, Rh negative patient mothers, in case of PPH happens, the blood may not be, I mean, that
Correct.
could
So
be
it can be
another issue.
catastrophic.
Yes,
Yes.
yes, 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 yes.
Yeah. Yeah.
Can a doctor use carbetocin for prevention of PPH if the doctor has used oxytocin for labor induction, which many times it would be happening?
Yes, sir. Definitely,
Yes,
it
yes.
can be used.
Mm.
There is no, it has been seen to be effective even where oxytocin has been used, because even though, yes, we feel that the oxytocin receptors might be already occupied, but there are certain other receptors which are available, and carbetocin is effective.
Effective.
Yes,
In fact, many, I mean, oxytocin would be routinely used. This case would happen, I suppose, for induction.
correct. Oxytocin is almost used every second or third case. So
Yes.
there is no contraindication, or it's
Yes.
not that carbetocin will not act in such cases.
Where would a doctor prefer a IV route or IM? IV route is known to give faster action as compared to IM, but the duration of effect of IM route is slightly longer. So would there be any case where you would prefer IV route over IM or vice versa?
I think generally, if the patient is undergoing cesarean section
Huh,
and already the IV line is there in place,
huh.
then IV route will be better, because
Better.
there's immediate action on the table, and we'll also know whether how the uterus is contracting.
Contracting. Correct.
But if she's
Otherwise,
had a normal delivery, and if there is no vein flow in intravenous cannula in situ, then we can go for the IM route.
IM route. Slightly delayed action, I suppose, for IM route as
Right.
compared to IV.
Right. But still, it will, I mean, that's what. So, in case if the patient is already started to have PPH, then IV would definitely be better.
Yes, yes,
If the
yes, yes.
patient, if you are giving it purely as prophylaxis, and if it's a normal delivery, one can give it intramuscularly also.
Intramuscular also. If the patient is not responding adequately, and you have answered this with carbetocin, what other additional uterotonics? You said you would
Yeah.
use
So, as I said,
carboprost.
most often we see that carbetocin is effective, and there is very rarely no response. But in case it happens, if there is less adequate response, then one can combine it with what we call carboprost,
Carboprost.
prostaglandins, which will give generally, which should have a good effect. Because carbetocin also is a prostaglandin derivative, so together it will have synergistic action, and we should have a good effect.
What is your
Of
experience
course,
of
one can
misoprostol?
also use misoprostol in such
Misoprostol.
cases
Yes.
additionally.
Yes. What are advantage of carbetocin over oxytocin, misoprostol, in particular misoprostol? How do you rate misoprostol as a uterotonic?
Misoprostol initially was very promising, but uh, nowadays there are some cases where it may not really work. Although
Okay.
it is a wonderful drug, and like carbetocin, it is also heat stable.
Yeah.
Whereas the main advantage of carbetocin over oxytocin is that, as we just discussed earlier, that it
Yes.
requires a cold chain for maintenance,
Correct. Correct. Correct.
and it has to reach all the clinics in the cold chain. Otherwise, the efficacy goes down.
Correct.
And other than that, I think the main important thing is the longer half life uh, as compared to oxytocin.
Oxytocin.
And yes, and also as compared to carboprost. it is of course again the other advantages. It is heat stable, so better shelf life as compared to oxytocin or carboprost or methergine. Methergine, of course, today is sparingly used because of the side effects.
Hypertension.
So hypertension and very strong contraction sometimes.
Okay.
So especially in patients of hypertension, heart disease, we generally don't use methergine. So therefore, such cases again, carbetocin would score over it. Uh, that's it. I think the main advantages would be another thing I feel is that overall it has got a better efficacy as compared to all of these utrotonics.
The force of contraction, I suppose, is the strongest with
Yes, the
carbetocin.
force of contraction is strongest, and the duration of the contraction is also
Is also
long.
the stronger. Yes.
So uh, sometimes, like with oxytocin or other, you need to add other utrotonics, which is
Correct,
not
correct.
so in the case of carbetocin.
Carbetocin. Should carbetocin be kept as a reserve drug, or it should be a first line?
No, as I said in that first case also, it should be used as a first line
First line.
because of
Yes.
the safety and the good efficacy.
And secondly, I mean, what is at stake? A life is at stake. Why keep waiting?
Correct,
I mean,
correct.
yes, we know what
Absolutely,
PPH.
absolutely.
I mean, I was fortunate to see only one case of PPH in JJ Hospital. I was from JJ Hospital.
Okay,
I'm talking about late 70s when I was doing my term. And at that
okay.
time we had only oxytocin and methergine. My
Correct,
God,
correct,
what
correct.
happened? Bakta Bakta, the patient went into shock. Fortunately, she came out. I
Ah,
mean, the whole department was there. It was, I can understand. So why keep it reserved when
yes,
life
yes.
is
It
at
can be
stake?
quite
Yes,
catastrophic.
correct,
Yes,
correct.
yes, 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 sir.
How do you compare adverse effect profile of carbetocin or other drugs?
As I said, one of the most important advantages is that it is very safe. There are hardly any side effects,
What side
especially
effects you have
even
seen, sir, with carbetocin?
meso. Sorry.
Carbetocin, have you seen any side effects with carbetocin use?
No, no, but I was sometimes. What was it? I mean, uh, um, I have not really myself. I have not had any side effects, but I had heard some other
Okay.
doctors having saying that some side effects they had had. But at least I've never come across any side effects
Side effects.
because, like, even simple things like with the carbopros, there is always that vomiting, loose motion,
Prostatitis.
things like
Yes.
that. With misoprostol, they can have fever or feeling of heat sensation. All those things are not there with carbetos.
And I suppose with oxytocin, sometimes there is
I think somebody had said
water.
they had seen bradycardia, but that is,
Okay.
yeah. So I think the intravenous injection can be given diluted and little slow, so these things
Slowly.
can be prevented.
And oxytocin sometimes has got that ADH type of effect, water retention, and then
Yeah.
yeah,
Correct.
that can happen.
Yes, sir.
So your one line to conclude, how would you
I think
conclude
it is one
your
of the most efficacious and one of the most safe and well tolerated uterotonic. And I would say among the entire list, it is the one which should be used as a first choice. And of course, if some other uterotonic has been used and it is not effective, one can add or give us a dose of carbetocin additionally.
right, sir? So in your opinion, carbetocin works well without major side effects and
Right.
is a good choice. One need not wait for I mean it can be used at the first line. It was pleasure, sir. It was pleasure interacting with you and getting your insights. It was especially a pleasure for a GM side talking to a GS person.
Old time rivalry.
Yeah, it is there, no? Typical Bombay versus
Yes,
Delhi, all those
yes,
games,
yes,
wasn't
yes.
it?
Yes, yes. But I think today it is much better.
Yeah. So
And
thank you
even
once
in
again.
those days, I think it was always a healthy kind of a thing.
Yeah. It was always healthy.
So,
Yeah, it was always healthy.
and
It was fun. It was fun,
yes,
basically. Yes.
it
So
was
thank you
fun.
once.
Exactly,
Yeah,
exactly.
yeah, yeah.
Thank you, sir.
Yeah. So thank you once again, sir. And thank you all the
Thank you.
participating.
Thank you for
Thank you all the participating doctors who took time from
thank
their
you everyone.
schedule